Hi and welcome back to another video of Medic Notes. This video will be on surgery showcase revision for arterial examination station. So first, the position of the patient will be lying supine on the bed and exposure ideally only wearing undergarments for adequate exposure. First we do inspection, look at the color of the lower limbs, whether there is any pallor of the skin, look for scars, and we must show that we are looking hard for scars. Look from the groin, popliteal fossa for scars as well. Trophic changes such as loss of hair on the toes or dry skin and shiny skin. Or is there any evidence of tissue loss such as ulceration on the lower limbs or gangrene noted? So we must show that we are looking for ulcer. Look between the toes at the heel, bony prominences and also malleolus. So if there is ulcer seen, we have to describe in terms of its location, which is the site, the size of the ulcer, the shape, the margin, whether it's regular or irregular margin, age of the ulcer, whether it's punched out ulcer or sloppy age, the floor consists of necrotic tissue or pink granulation tissue, the base, whether it's bone or tendon, is there any discharge, such as pus discharge or bloody discharge, or any bleeding from the ulcer, and also comment on the surrounding skin, whether there is any erythema of the skin. Next, we can proceed to palpation on the lower limbs for the arterial examination. So we check for the capillary refill time, feel for the temperature of the lower limbs using the dorsum of our hands, and also feel for any tenderness, feel all the peripheral pulses from proximal to distal. So feel the femoral pulse, popliteal pulse, posterior tibialis pulse, and also dorsalis pedis. So these are the locations for these four pulse. The femoral pulse would be located at the mid-inguinal point, which is the midpoint between the anterior superior iliac spine and the pubic symphysis. Popliteal pulse will be at the popliteal fossa, around medial 1/3 and lateral 2/3. Posterior tibialis pulse will be found between the medial malleolus and the calcaneum, whereas dorsalis pedis pulse will be found lateral to the external hallucis longus tendon, around the first web space in the foot. So next we should also palpate for the sensation to check the light touch, pinprick sensation, proprioception, and also vibration sense in the lower limbs. So to complete the examination, we should also comment that we would like to check other peripheral pulses in the upper limbs, such as radial pulse, brachial pulse, and also carotid pulse. Palpate the abdomen for abdominal aortic aneurysm, and also do a cardiovascular examination to check for any atrial fibrillation or murmur noted. So in discussion, we might be asked on how to measure the ankle brachial systolic index. So the equipment needed will be a handheld Doppler plus a BP cuff with the meter gauge. So first we will measure the brachial pulse first. First, secure the blood pressure cuff over the patient's right arm. Then we locate the brachial pulse using the Doppler, handheld Doppler. Inflate the BP cuff until you cannot hear the Doppler. Then slowly release the pressure until the Doppler sound reappears. So that BP reading will be take noted. And then we repeat this procedure for the left arm. So that is how we measure the brachial pulse using the handheld Doppler. Next, we will measure the ankle pulse. So similarly, we will secure the BP cuff on the patient's lower part of the cuff, locate the posterior tibialis pulse using the Doppler, inflate the BP cuff until you cannot hear the Doppler sound, and then slowly release the blood pressure until the Doppler sound reappears. Take the BP reading and also repeat by using dorsalis pedis pulse. So that is how we measure the ankle pulse. So after measuring the brachial pulse and also ankle pulse, then this is the formula to count for the ankle brachial systolic index. So the formula is shown over here. So the calculation is done by dividing the higher systolic pressure of either the dorsalis pedis or posterior tibialis of the respective leg. So in this picture here, this is when we measure for the right leg. So the right ABSI will be highest pressure, either dorsalis pedis or posterior tibialis pulse in the right foot, divided by the higher blood pressure of either the right or left arm. Whereas for left ankle brachial systolic index will be replacing the right with the left. So highest pressure in the left foot divided by highest pressure in both arms. So either right arm or left arm. So to interpret the ABSI result, normal would be 1.0 or more. 0.5 to 0.9 means that usually the patient will have intermittent claudication. If it is less than 0.5, then it indicates for critical limb ischemia. Whereas if it is abnormally high, more than 1.3, it suggests for calcified vessels. That's all for this video. Thank you.